97% of Americans are struggling with long-haul COVID, according to a new survey that was released. Of course, so many of us say the symptoms seem to linger forever and ever, and it turns out there's some validity to that.
Yeah, when you work that out, close to 7% of Americans, that's almost 18 million people suffering with those long COVID symptoms. And this morning, Erie News Now's Megan Selensky talks with our contributor, Dr. Becky Dawson, to find out how you can tell if you have long COVID and what to do about it.
Dr. Dawson, thank you so much for joining us again this morning. My question to you is, we know COVID's new, we know long COVID's new, so can we talk a little bit about what long COVID is and what we should do if we think we have it?
Correct. So long COVID is defined as having symptoms that last outside of a couple of months post-COVID. So long is relative in this situation. We're coming up on the 4-year anniversary of COVID. So we've only known about it for 4 years, but some people are experiencing symptoms, everything from fatigue to pain to, lung disorders, diseases, discomfort. And, kind of a mix of things for longer periods of time, something that you would expect, post clearing the infection, post your immune system doing the work, that you wouldn't experience these symptoms, but we're seeing them persist for longer periods of time.
Again, 4 years sounds like a long time, but it's really not. So if I'm in this period where I had COVID during the pandemic and now I'm still feeling some of these things, what do I do?
So you really need to go see a physician. It could be that you have, you're one of the people that is suffering from long COVID. It could be that you're fighting another infection or there's something else wrong. Fatigue, sore throat, trouble breathing are symptoms of many diseases. They are underlying, kind of causes of things. So, really the idea is if you're feeling like you have these long COVID symptoms, it really is important to go visit a physician, rule other things out, and then maybe address the fact that you might be suffering from long COVID.
And as an epidemiologist, you're very well versed in the field. What are you hearing from other professionals just about the research and the funds going into finding out more about long COVID?
We really don't have a lot of data because the first cases were, diagnosed less than 4 years ago. And, to get an entire new research program up and running that is robust and is large enough that has a sample that represents, the population that's getting long COVID, that's a lot of work. It's also a lot of money. And so we are starting to see new funding streams to support long COVID research start to emerge. But, this is a budding new, very, kind of in its infancy type of research. And so there's a lot of work left to be done. And what we know about long COVID is from, kind of pieces of information and small studies that have been done, and really comprehensive work is needed, but a lot of funds, a lot of time, a lot of money, and a lot of expertise to do that work.